My name is Dr. Christopher John. I'm here to guide you through the motor skills of directional non-force technique. Directional non-force technique for many decades has been noted for the most powerful results in chiropractic, capable of doing things that doctors dream about being able to do. But how can DNFT do these things? In large part, it is because of the diagnostic method that we have. We're using the patient's body directly to give us information about subluxation. Subluxation is misalignment producing active nerve interference. So we can glean directly from the patient's body what is going on where. And how do we do this? It is a combination of challenging, a testing whereby we gently push or pull a structure to see if it is actively producing nerve interference. The challenge is quickly followed by a leg check. A leg check which reveals either a pull-up of the reactive leg or a non-pull-up of the reactive leg. If the reactive leg pulls up short, that is a positive test. So now we can determine not only which segment, which tissue is in a state of subluxation, but all the directions of this tissue. It then becomes extremely important to learn this testing procedure so that it is reliable and so that it is accurate. This requires practice, and the purpose of this video is to guide you through the initial steps and even some advanced concepts in a way that you'll be learning the correct way to do it and not gaining any bad habits. We will begin with thrusting, and then we'll go through the supine leg measuring, and then the prone leg measuring, and finally putting it all together, coordinating all the different skills that we acquire. DNFT thrusting. It is through the thrusting that we take the listing that we've obtained through our method of analysis and impart a correction that neutralizes the nerve interference that exists. So the thrust is, of course, very important, and we find that in DNFT it is important to impart a certain character of thrust. We find that if you were to thrust too hard, the body could perhaps reject the thrust. If you back off on your tension that you take as you're doing your thrust, then also the thrust may not go through. If you thrust with too little force, the body may not accept very much of the thrust, or if it is not speedy enough, if you lack what we call a spike. All of these things have very much to do with how successful, how long-lasting the correction is that we're trying to achieve in DNFT. Now, to get our grip, first of all, we have our thumb, we make somewhat of a fist, and we bring our thumb next to it like this. Having the thumb next to the knuckles creates a stability that is very important for two reasons. One, it delivers this spike or this impulse that we talk about. Secondly, it prevents us from having an injury on our own thumb, because if this thumb is out like this and you begin to thrust, look at what is happening. You are beginning to create a chronic use syndrome or even maybe an acute injury by thrusting like this without stabilizing against your knuckles. I must say, however, in the same breath that there are some thrusts that you will do on the cranials, TMJ, and when you use the modified thumbnail, in which you do want a little bit of openness. You do want actually to absorb some of the energy because you want to throttle the thrust. In such a case, you're not going to be thrusting so hard to begin with, so you really shouldn't injure yourself. But when you're adjusting the spine, here's what you do, like this. With the other hand, same thing. You make this fist, you bring your thumb together, and you're creating a V. See that V that we have right here? And then you take that V and you put it over your thumb like this. So there we have our grip. This surface right here is approximately what you will use to thrust. Now it may look like the knuckles will be on the skin a little bit, but you should feel the main point of your contact being the thumb. Perhaps not the exact undersurface, maybe over here or here, but it will be like that. Now, you take your grip, you're palpating where you're going to go to, you take your tissue pull, you keep out your tissue pull, and thrust. Contact back away, elbows. Contact, back away, elbows. A very important consideration with the thrusting is our tissue pull. It's extremely important that we don't back off on it. Say we had a subject here. Our tissue pull consists of palpating the structure, taking tissue pull to that structure. You have the tissue pull out. Leave it out. Do not let up on that tissue pull. Back away, elbows. Notice how my elbows, snapping together at the end of my back away, create the impulse that we're talking about here. And notice how I back away from where I am. Some people have been seen to just go down like this. Am I backing away? The answer to that is no. You want the distance between your episternal notch and your point of contact to increase. This is what backing away is. Van Rump used to say that this prevents the thrust from becoming a force of imposition, but rather a force of correction which the body will accept. Some of the more common errors would be shoving, like this, because it's what you learn in school. There's no shoving. The way to get around this is when you take your tissue pull, then consider the inside of the elbows going straight toward one another. Inside of the elbows going straight toward one another. That way, your mind is completely off of shoving forward with your hands. You already have your tension. Just think elbows medial. Elbows snapping toward one another. If you try to snap too soon, you may injure yourself and shove at the same time. So wait until you have backed away far enough for that impulse to occur. If you wait too far, if you go too far in your back away, then you won't feel a spike. That impulse will not make its way through. You'll be putting all the energy into your own joints. So as you back away, you can play with this point a little bit. You don't have to be actively backing away too much or too fast. You can just go a little bit and such as this. A few more things to watch out for. You do not want to use the wrist. Watch this. This would be many people making this error. You will see this, but you should not see it, but you will. Wrist. Wrist as opposed to elbows. The thumb and the hands form a bridge which is more or less like a platform. There may be slight movement. There is a little bit of absorption of energy through them, but it should be acting as a platform, a vehicle of delivery for the impulse of force created by the elbows going together. So no wrist. Another thing to watch out for would be swiveling. Notice it's almost a torque-like motion. Do not get in the habit of getting into this swivel like this. Instead, straight elbow, inside of the elbow, straight toward one another. How would you thrust on a lateral nose, a nasal bone, say on the cranials? Well, you actually would. Say if this was the nose right here, you actually would open up your hand a little bit like that. You're stabilizing on the head and the cranials. You open up here so you don't put that much force. You don't want to put that much force against the nose, like this. Can you thrust with just one arm and not the other? I have a permanently injured left elbow, and although I do use it, I have a tendency to use my right. What does that look like? See how I still employ it a bit, but I'm mostly using my right. One has to be very conscious of force vectors when you're only using one elbow. You have to think of it mentally, what your intention is, and your setup also has to be designed to translate that. If you can at all do it, it is better to employ both. If you can employ either one, it becomes helpful. As you go around the body, you'll thrust this angle, you'll thrust that angle, but generally, head on, Back your sternum away, no swiveling of the elbows, no using wrist. This is what it looks like. In DNFT, one of the most important things we do is the disc adjusting. The disc adjusting is similar to what I've just described, but yet a little bit different also. Remember, we're using one of these two plexures that we have here. Here is our blunt plexure that we use between L5 and perhaps T4, T5, and our interlaminator plexure with this sharper tip on it that we use interlaminar, and then I use it even for the posterolateral discs from T5, T4 on upward to C7. But what we do, let us say we're taking this, and let us say that we have a subject here, and we were going into the IVF. Now when we're taking our tissue pull, we don't really want to take our tissue pull back away elbows. That rhythm that we have been doing for our regular thrusting is not going to work very well here. We cannot hold the tissue pull and do a back away. Instead we have a very quick fluid movement. We take our position, we palpate where we want to be, we get our plexor in here, and we in tissue pull and out is one movement, in and out. Now what have I done? If I were to do slow motion, I'm going in, taking my tissue pull as I'm actually beginning to come together with my elbows, and then at the end I have my elbows. So it's that fast. It looks like I have shoved a little bit, but if you really look at it closely, I'll try to do slow motion. It's actually taking tissue pull at the same time my elbows are beginning to go together, so that I take my tissue pull and impulse so fast together that it's almost one motion, like that. I'll try to do a few more. Like so. DNFT supine leg measuring could be said to be more primary than the prone. Now, in fact, the feet are moving the same, hopefully moving the same, both with the supine and the prone. But as you begin to learn the supine leg measuring, you can see more easily what is going on. With the prone, there are certain things that are a little more hidden. There are certain errors that are easy to do that are a little more obvious with the supine. So we begin with the supine, and of course also the supine is what we do when we begin a patient visit. The patient is lying on the table supine. I'm going to begin here by just showing some correct supine leg checks. As a general overview, we are attempting to separate the heels and separate the toes simultaneous, approximately equal distance. We would call this equal eversion. Later on in the video, we will talk about the 50%, 100%, or under-over as we call it, which is what we do to elicit the actual pull-up of the reactive leg. But to learn the leg measuring itself, we must begin with equal eversion. So here is the eversion, correctly done. I'm separating the toes and the heels. Separation of toes, separation of heels, with a rhythm. 1, 2, 1, 2, 1, 2, 1, 2. Separate heels, separate toes, approximately equal distances. 1, 2, 1, 2, 1, 2. So we are going to investigate what we call 3 basics of approach. Over the years of teaching this leg check, we found it's very good to begin with 3 basics, and they're always there. No matter how long you've been doing DNFT, you will always think of these 3 basics. The first of the 3 would be the grip, how it is that we grip the shoe. Now, what I'm about to describe here is just for the supine. Note that as I grip the shoe, first of all, looking at it from the side, that my hand comes up, and I must have these fourth and fifth fingers of my hand curled in a semicircle so that they hit the underside of the heel as a stop. So as I come up, they stop my hand so that my hand hits this shoe exactly the same way every time. Now let us suppose that instead of using these two fingers wrapped around the heel and these other two fingers hitting underneath, I were to use 4 fingers or 3. Maybe one time when I would grab here, I'd have all 4. The next time that I would do a leg check, I'd come up, now I have 2, but maybe the next time I would have 3 or 1, but you can see how variable it is. You'd be hitting the shoe different leg checks. Instead, you want to be sure that these 2 fingers are wrapped around the heel, that these other 2 fingers are on the underside, like so. And then now also notice that the thumb here is straight across the heel of the shoe. This corner of the heel of the shoe should be at the corner of the web of my thumb, so that it looks just like this. We do not want the thumb to come over here to try to grab the opposite corner of the heel. Many people do this. It gives them a sense that they have the ability to put more force into the eversion, but it does not lend itself well to doing it accurately. It will destroy the accuracy even though it may give you a sense of strength. Therefore, bring your thumb down so that the corner of the web of the thumb is in the corner of the heel of the shoe. These 2 fingers wrapped around the heel, these other 2 fingers underneath. With the supine grip, we want to make sure that we do not get what we call a rat hole. There are 2 types of rat holes. If you had a lot of air right here and you're grabbing the shoe like this open space here we call a rat hole. You can see right through that space in between the shoe and my hand. There's another type of rat hole which may be separate. You may have a flush grip up here. However, underneath, it's open here. There's a rat's nest. So it should be more like this as opposed to open like that. Doesn't have to be 100% flush, but pretty close to it. So now we have very little space here. Viewed from over here, we have very little. There'll be a little bit, but not anything like that. After teaching seminars for a number of years, I can tell you that the primary reason why people have trouble on the supine leg measuring is because they have not consistently utilized this very simple grip. You must utilize this grip. Okay, that's the number 1 of the basics. Grip, then the next thing would be parallel forearms. Now, when I am discussing now parallel forearms, I am discussing that the forearms should be parallel to the floor. I don't mean parallel to themselves like this as opposed to like this. I mean parallel to the floor as opposed to like this. For example, I approach the patient. Of course, I have the luxury of a hydraulic table, which is pretty high here, but I get down however far I need to so that my forearms are parallel to the surface of the floor. What would be an error if I was like this? A lot of people doing leg checks like this or attempting to do leg checks like this. It might give one a sense of ease on the low back, but what you really need to do is get down there so that the forearms are parallel to the floor. With the fact that this leg piece is raising the legs a little bit, this does add a bit of an angle so that if my forearms aren't exactly parallel to the floor, they can be up a few degrees, perhaps 5, maybe even 10 degrees, maybe, but that's pretty much it. At least my arms are pretty much parallel to the plane line of her leg. So that is the second basic. We have the grip, we have the parallel forearms, and third basic would be the wrist angle. That means when we employ our grip with the parallel forearms, that we have a wrist angle here that is very close to 0 to begin with. What do I mean? If I just freeze my wrist and forearm and I bring it out, as you can see here, the angle that my wrist makes with my forearm is essentially 0. This would be maybe a 45-degree angle. This would be a 90-degree angle. And as we'll see later, this is actually a negative angle this way. But here's about a 0 angle. This is about what you want to begin the leg check on most people. You may occasionally run into someone that will require you to have a little bit of a wrist angle, but pretty much try to get it down to 0. Let me illustrate some correct and incorrect examples of wrist angle. Here is correct. Notice how with a correct wrist angle, as I go around the pin, as we call it, my forearms are doing most of the work. My wrist is really moving very little. Here is a too much wrist angle. With too much wrist angle, there's a tendency to do what we call sawing wood. Sawing wood. It was a long time ago, I think in the early 50s. Van Rump actually taught it this way. He eventually concluded this was not the best way to go. But this would be sawing wood with too much wrist angle. And this negative wrist angle that I was referring to before, sometimes people more or less wind up with it. They start with a negative wrist angle and then it turns into a flick. Okay? A flick. We do not want flicking at any time with the wrist because this makes for inaccurate leg measuring. Instead, start with 0 wrist angle and keep your wrist movement down very much throughout the entire movement. In relation to both the parallel forearm and the wrist angle, let's take a look at some possibilities, what we should strive for and what we sometimes see. A good starting solution, I've lowered the table here to make it similar to what you would see at a seminar with our portable tables. I would bend forward at the waist, come down so that my forearms are parallel. I then position myself close enough to her feet, and notice I'm pretty close here. Close enough so that my wrist angle is very close to being 0. Then when I do my leg check, I'm just going around like that. At first you may lunge slightly forward into the feet. That helps you go around the pin, as we call it. But a couple things not to do. Don't stand so far away from the feet. I'm going to be exaggerating everything here. Don't stand so far away from the feet. You're down here. What is happening? Well, first of all, I can't go around my forearms because I'm too far away from the feet to do that. Second of all, look what happens to the wrist. See the wrist here? I'm sawing wood because I'm standing too far away. It's almost hard to get too close. You can move up pretty close. In fact, if you have a very tough pair of feet, getting in extremely close will help you, as we'll see, like so. But just normally right about here and in. Also, don't start out like this, because then there's nowhere to go. Plus you'll tend to chicken wing. Come up like this. So here I'm standing too far up and in. Again, forearms parallel, 0 wrist angle, close, pretty close, and a more comfortable leg check, plus more correct. We're now going to talk about how these elements of 3 basics plus some other considerations come together and the problems that result if they don't come together correctly. They're all a little bit interrelated, so let's just start at one point here. We talk about the toes going down and out. Now, when we talk about toes going down and out, I want to distinguish that from torquing. So let us take a look at the difference between the two. Toes going down and out, doing the leg check, would be this. Toes going either along the plane line of the horizon or slightly down, down here like this, as opposed to this. This would be torquing, or lifting. This is lifting. Lifting. Now, these are the 2 things to watch out for. Lifting results from not using the thumb to get the toe down. Remember, the thumb is going along the heel of the shoe. The thumb is responsible for getting the toes, whereas these two fingers are responsible for separating the heels. Tips of the second and third fingers separates the heels, thumbs separate the toes. They must work together. They must work together like this. But if you don't use the thumb, you have lifting. Lifting of the toes, this, instead of this. Instead of this. You may also get torquing. This is not what I mean by toes going down out. Torquing instead of heels and toes separating. We want heels and toes separating, like this. Like this. Heels and toes, no lifting, no torquing. We're going to take a look at the interactions down here at the foot, between the hand and the foot. And we have a couple of tests, the dot test and the parallax test. Now for the dot test, all you do is put a standard dot here on the heel of the shoe. And what we're going to do is aim the finger of one hand, the hand that is not doing the foot check, and we're going to aim it at that dot. Now you have to aim straight into it, perpendicular. In other words, not like this or like this, but just straight into it. Then you take your other hand to do the leg check, and let's see what happens if we do it correctly. If we do that correctly, the dot moves directly away from the finger, like so. If you torque, look what happens to the dot. Suddenly, the dot has moved out of the picture like this. This instead of correct. Correct. This is an excellent test that you can do for yourself. If you were to lift, it also is not good. It's not as dramatic a result as when you do the torquing. So this is more indicative of torquing. However, it still, as you can see, does not work out when you do the lifting. It only works correct when you separate both the heels and the toes. Now the prone leg measuring in DNFT involves principles very similar to the supine, adapted differently through different grips and so on. But still, let us begin with seeing some correct prone leg checks. This will be equal, 100% on both sides. 1, 2, 1, 2, 1, 2, 1, 2. Using, as we've already discussed, forearms and not wrist, stabilizing the wrist to maintain a low wrist angle using elbows and forearms to go around the pin. Notice the heels separate and the toes separate, both. Heels separate and toes separate. Heels and toes both. We'll now investigate the same three basics: the grip, parallel forearms, and wrist angle. Now the grip on the prone consists of grabbing the shoe with the thumb going right underneath along here, and here again, this corner of the shoe here formed by the heel and the corner of the sole should be where the corner of the web of my thumb is, like this. There is a very common tendency to want to go over and grab the opposite corner of the sole with the thumb, but that does not work out good in the long run so far as accuracy of leg check is concerned. Therefore, always wind up in the same place: corner of the web of the thumb, corner of the heel of the shoe. The rest of the hand wraps around like this. Of course, there's not, the foot isn't in the shoe here, so you won't see this as well as you will later. but I want you to note that the fifth and the fourth, and to some extent even the third, second fingers are involved with the forces that get the toe to separate. Whereas here again, the thumb is going to be separating the heel. Is there a rat hole with this approach? Yes, there can be. Here is what we call an air hole that we call a rat hole. Now this would be an upper rat hole up here. This is an upper rat hole without a rat's nest. Here's where we have no rat hole, but underneath, take a look at what's going on here. All of this airspace between the palm of the hand and the foot. There does not have to be 100% contact and coverage, but it should be a lot better than that, because now we have more control. We have a fairly tight upper and a reasonably tight lower, no rat holes or air holes there. Thumb across, corner web of the thumb, and so forth. Our next basic being the parallel forearms. Here again we're referring to the forearms being parallel approximately to the surface of the floor and approximately parallel with the leg, which here is a little bit of an angle. We don't necessarily mean that the forearms need to be in like this, parallel to one another. They just, in fact, you should start with your elbows out a little bit comfortably like this for most feet. However, we don't want you to be standing straight up with a big angle like this. This is the lazy way of doing it, but it is not the right way. This is the lazy man or woman's eversion. This is the correct one. Get down. Get down so your forearms are parallel to the floor. The next topic to consider with the three basics would be the wrist angle. Here, just like with the supine, we would like to begin, don't stand way far away, don't come in so close that you're here, but rather a comfortable position. This far away so I have some angle of my forearms with straight ahead. However, the wrist is close to zero, close to zero. Let me remove it. See? This angle here is pretty close to zero. Here would be 45, here would be 90. Here's a negative angle. Once again, if some people get too close, they're starting like this with a negative angle. What does it lead to? You can't go around the pin because you're already up here, see? So instead, people that do that generally flick. Flicking. Flicking is something that is automatically incorrect. Easy to do when you're not thinking about it, but not correct. No flicking, that's using wrist. Speaking of grip and flicking, there's another thing that occurs more with the prone. It doesn't really seem to occur that much with the supine. It's called squeezing. Van Rump used to call it using hand. This is where you have your grip like this and you're literally squeezing, trying to squeeze the foot into an eversion. Can you see that? I'm going like this, trying to squeeze the foot upward instead of taking your grip, a solid grip, and then around the pin. A solid grip and around the pin. Sometimes we call this a lobster claw grip, meaning that when a lobster takes a grip, it's set and that is it. The grip is there, there's no wrist to fool around with. It's all forearm. So your lobster claw grip and around the pin. Grip, forearms. Grip, forearms. For some people that should be a mantra. Grip, forearms. Grip. Is there some wrist involved? A little bit. There's a little bit of wrist, but not much. As you can see, not much. It's mostly forearms going around the pin. Now, we talked with the supine, talked about how there is a pin, there's still a pin here with the prone. And it's like the foot is opening around that pin. You can see it very clearly here. There's the pin. It's like opening a door around a hinge. Notice how when you do it correctly, the door is going around the hinge, so to speak. But if you dive medial, look at how the dynamics now change. Diving medial, diving medial. What does it involve? Usually flicking of the wrist, not stabilizing the wrist. Flicking medial as opposed to around the pin, around the pin. Notice how both the heel and the toe must move. Here is our parallax test. Very important with the prone. See how both the heel and the toe moving away create correct leg measuring. Heel moves out, toe moves out. Heel and toe moving out. If you torqued, here's prone torquing. Heel moving out, but the toe going nowhere. Prone lifting, toes going up, heel going nowhere. Heel going nowhere. Done correctly, both move out. Both move out. Again, lifting, torquing, as opposed to correct. Heel and toe moving around. Heel and toe moving around, being performed or accomplished with the forearm and stabilizing that wrist. Now, if you don't stabilize the wrist, what happens? Passive wrist. Passive wrist leads to sawing wood. This is what Van Rump used to teach 30 years ago, but then didn't teach it because he found it didn't work out so well. Sawing wood as opposed to going around with the forearms. Going around like this. What is a partial passive wrist? Again, with the prone, a little more subtle. Here's a partial passive wrist. I'm doing a partially correct leg check, but I'm doing it because I'm pulling my forearms lateral, but I'm allowing my wrist to flex a little bit. I'm allowing them to destabilize. This is not as good as this. Can you see how more consistent and accurate it is to use to stabilize the wrist and to utilize the forearms in going around? Take a good look at this excellent view of how the feet should move, opening like a door on a hinge. In examining the relationship of the forces involved with the prone leg measuring, similar to the supine, the force that the thumb produces must go along the plane line of the heel. Just like this now. It shouldn't be up. It shouldn't be down. That's where it is for people that yank it toward the floor. But again, right along the plane line of the heel. For this heel here, it would be up there. For this one, it's right there. Now, let's take a look at what the second and third fingers do. Again, here's the force vector of the thumb going along the plane line of the heel. But note, because of the fact that I'm not, see, if I incorrectly grip my thumb around the corner like this, where are my second, third, fourth, and finger? They're nowhere to be seen because they can't make their way around. So if I take the correct grip, now notice my fingers are set to produce some force. This force is straight over like this. This force is what causes the toes to separate. Thumb, heel, fingers for the toes. The toe separation is a very important point with the prone leg measuring. You may be doing a good job on the heel, but if you are not separating the toes, you are not going to see that leg pull up correctly. It either won't be dramatic, or if you make enough error, it will not even appear to be there at all. So you have to separate the toes in order to correctly see that pull up of the reactive leg. This is how critical it is. So we need to spend time talking about how that fourth and fifth finger, and to some extent even the third, possibly the second, but mostly fourth and fifth, are involved with separation of the toes. There's no good to separate the heels if the toes are not going along there also. Like this. When we grasp the feet, make our contact with the prone, we want to allow them, just as with the supine, to have their integrity. This means when we grab them, we take them where they are. Wherever they are in space, accept them as being there, then do the leg check. Accept them, and then do the leg check. Do not grab them and then do the leg check, such as this. Wrong, 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 as opposed to correct, correct. Do not induce dorsiflexion. This may occur if you're yanking toward the floor, like this, dorsiflexion, or if you lift, you may be producing plantar flexion. Both of these things produce visual errors in terms of seeing the pull-up or lack of pull-up, as opposed to correct, correct. Notice how my thumb is producing this force vector. This view, you can see it coming right at you. The right thumb going right along the plane line of the heel, separating the heel, while the toes are separated by my fingers, which are doing the right thing, but if I were to dive medial, can you spot the difference now? Instead of coming out, it's diving in. In, accompanied by a flicking of the wrist. Wrong, wrong, opposed to correct, correct. When we do our under-over with the prone, as with the supine, it in theory is not a big leap to go from going equal on each foot to selecting one and backing off halfway, such as the right. Instead of going all the way, I'm now going to go halfway. Here's what it looks like. Halfway. I'll reverse it. I'll go half on her left, full on her right. Again, half on her right, full on her left. What happens when we begin to make errors with the prone? Quite often the toes do not separate, something not easy to see from where the camera is at the moment, but I don't know whether you can catch it, but right now I'm half everting the right, but the toes aren't going anywhere. This could nullify a pull-up, or lifting perhaps. Now I'm going half, but I'm lifting on the under. Here's the under. See, I begin to lift. Instead of going like this, I go like this. See? Instead of there. Half everting the right, fully everting the left. Notice, wrist stabilized. You can lunge forward a little bit if you would like. She happens to have a right reactive leg, so if I half evert the right and fully evert the left, can you see that pull-up? Equal, no pull-up, under on her left, over on the right, also no pull-up, but under on her right. Can you see that? Again, I can even show you slow motion. Slow motion still produces a shortening, a pull-up of the reactive leg. Whereas if I under-revert her non-reactive leg, no pull-up occurs. Normally we don't push together like this. I'm just doing it so that you can see it more clearly. But here's the mechanics of doing the under-over. Under on her right, over on her left, pull up each and every time. Notice how the toes must separate. Toes must separate. Heels must separate. I've marked off the right reactive leg, which she has, and I'm going to begin by doing equal eversion, which should not result in a pull-up. Here are some equal eversions. If I move her feet a little close, you can see they're relatively even here. Now let me apply the under-over, under on the reactive side, over here, and you should see a shortening of the right leg. I'll hold it, and if I very carefully bring the feet toward each other, you will see approximately, about a ½ inch pull up in her case. ½ inch, maybe slightly less. She doesn't have one of the most dramatic pull-ups that I've ever seen, but it is visible. Pull up here. Suppose I did a half version on the non-reactive leg side. Nothing should happen. Let us see. Under on the left, nothing occurs. In fact, under on the left, here I'll hold it, and again come close. See, they're even. That is the same as if I had done equal. Equal. And I'll go back again to causing the pull-up by doing the under on the side of the reactivity. A very big topic is the ability to see the actual pull-up of the reactive leg. When you first start to see this as you're learning the leg measuring, it's a very exciting thing. However, as you progress, some people on occasion will say, well, I just didn't see that leg check. And maybe 3 other people had just gone by that subject and had no trouble whatsoever seeing it. So what are the things that we can do to enhance a dramatic visual appearance of a pull-up? First of all, doing the leg check correctly is the biggest factor. I mean, if you should really see the bare minimum ½ inch. 3/8 would be the absolute bare minimum. I mean, that's a patient that's a little bit sick that does not have a nice, healthy pull-up of the reactive leg. So 3/8 inch minimum. Normally, though, it would be ½ inch or 5/8 inch pull-up, if not more. So faults, errors with the hands and the feet that we've been talking about up to now are the major reason. But there's a couple of other things. First of all, let's take a look when you do your challenge. Let's, rather than have me walking back and forth, let us say I was testing for a knee subluxation, and then I'm looking here. Now my eyes glance at the fact that the feet are here so that I can position my hands on them. But at this point, I am not actually looking at my hands. I do the leg check and then I look down. So this is the key. Once my hands are positioned on her feet, all the proprioceptive mechanisms of my hands and my fingertips tell me that I have the correct grip. I can feel that I'm just at the right place. My forearms are parallel. My wrist angle is 0. And what am I thinking at this point? I've already done the challenge. I've maintained my continuity of concentration on that. Once my hands are now on the feet, I'm mostly thinking of separating heels and toes. I am thinking about those things we've talked about not torquing, not lifting, maintaining the 3rd, 4th fingers separating the toes, the thumbs separating the heels. And I'm feeling, my eyes may be looking up here, but at this point I am feeling my hands separating the heels and the toes approximately equally. This is so important. So I do my test. I may look at the feet. This all happens in fractions of seconds. Grab the feet. I don't care where my eyes are looking because it's all feeling at this point. Do my leg check. Then I look down. Then I look down. Notice if I have to move very close, without moving the feet, I can move my head down so I can then see. Notice her feet aren't going anywhere, but my body is going back and forth. This is a little exercise, a little drill that you can do for yourself. But as I move back here, then I can look down. In doing the under-over and actually obtaining subluxation listings, there is a way of coordinating the challenge with the leg check. Now, I'll show you the way to do it and a few things not to do. But as we're going back and forth, say we've just done a leg check, we're positioned here. If I happen to do my challenging on the right side, which I normally don't do, but you could go either side, I put my right foot, which is in now position here, over here, and then go 1 or possibly 2 steps up. Then I do my challenge. And then I go back the way that I came. 1, 2, into the center and do the leg check. I'll show that again. 1, 2, 3, do my challenge, go back the way that I came to the center and check. Now, how long do you have between when you do the actual challenge and the leg check? Approximately 3 seconds, 3 to 4 seconds perhaps, with a good flow of concentration, maybe a little more. In the latter days, Van Rum took him a while to get from up there to down here, but as long as you maintain your flow of concentration, it's okay. You want to maintain facing toward the head of the patient as you do this. What you don't want to do is go up here, challenge like this, and then turn around, walk this way, come back around, and do the leg check. You're interrupting a flow of energy and concentration between you and the patient when you do that. You can also go up this side like this, do your test, 1, 2, center, center, check. So let's see how that works out time-wise. I'll use the usual way of counting out the seconds by thousands. Up here, 1001, 1002, 1003, and as you can see, without moving very fast at all, I have done the leg check well before even 3 seconds. There's no great advantage in getting back here quicker, but as long as you're here within 3 seconds, that's good. Once again, no turning away from the patient like this, plus it would take more time. Just a out, up, up, challenge, back, back, center, center, and the under-over. Another technical, advanced, but very important point is to see a dramatic pull-up of the reactive leg. Sometimes you have to position yourself so that instead of looking directly, being directly here and looking directly at the head, you may have to angle yourself off a little bit. And as we will see, this is not cheating. This is not cheating, because a lack of a reactive leg pull-up still appears as level heels. Now, what am I talking about and when will you have to do it? This might not be a bad example right here of the sort of feat where I would have to position myself. She has a right reactive leg. I may have to position myself a little bit over here, because otherwise the reaction, the magnitude of pull-up will appear to be very small or maybe even not at all. This is because her right foot has a tendency to remain stationary with a little bit of inversion. Actually, I should, inversion, a little bit of inversion on her right foot. This one is pretty much natural or straight. So, as we know, when you grasp the heels to do the leg check, you cannot put them where you would like them to be. You have to take them from where they are. So since this is the way her feet are to begin with, when I then finish the leg check, as I look down here, I see a very dramatic pull-up. But if I were to get myself right in the center, in her case, I'm looking at a pull-up which is much less. This is not cheating. It does have to do with the way that her feet lie in relation to inversion and eversion, and in relation to each other. You may, on some occasions, actually find somebody with both feet a little like this, with feet like this. In other words, if her feet were normal, they would be perhaps like this. But look at how her feet actually are. See that? Her feet are more of the type that would require that instead of looking head on, I move over a little bit. So if I move over a little bit and I do this leg check, perhaps you can see there is a pretty good pull-up if I align myself with the way that her feet lie. But if I look straight in the middle, I just don't see that same magnitude of pull-up. From the distance from here to here, viewed straight on in the center, diminishes the pull-up that I should be seeing. It's an advanced point and a very important one. Generally, one would angle slightly away from the side of the leg that is the reactive leg. It usually turns out that way. But it has everything to do with how her feet are lying like this. It's not cheating at all because the lack of a pull-up is still seen as completely even heels. Okay? Whereas a pull-up now is seen much more dramatically, much more dramatically. This DNFT video originally was not intended to take the place of a DNFT seminar. Some people in foreign countries, however, may be able to get started on DNFT with this latest DNFT motor skill video. Watch the video frequently. Mark and find what areas that you find that you need feedback on the most, that you need to see the most. The so-called neurocybernetic effect, just watching some of these motor skills being performed on the video, even that can help your performance of these motor skills. I would suggest visiting our website, finding out when the nearest seminar is that you can attend, and go to as many seminars per year as you can to get personal feedback from me and other experienced DNFT doctors so that you may begin with your success in DNFT as soon and as fast as possible.